Good evening. Welcome to the 198th day of the Swasthya 365 Days project. Today we are going to talk about arrhythmias. An irregular heartbeat is called as an arrhythmia. It's also called as dysrhythmia. Heart rates can also be irregular. The normal heart rate is 50 to 100 beats per minute. Arrhythmias and abnormal heart rates don't necessarily occur together. Arrhythmias can occur with a normal heart rate or with heart rates that are slow called as bradyarrhythmias less than 50 beats per minute. Arrhythmias can also occur at rapid heart rates called as tachyarrhythmias faster than 100 beats per minute. In the United States, more than 850,000 people are hospitalized for arrhythmias each year. What are the causes of arrhythmias? Arrhythmias may be caused by many different factors like the coronary artery disease. Coronary artery is the artery which carries the blood supply to the heart. Electrolyte imbalances in your body, such as sodium or potassium. Changes in your heart muscle. Injury from a heart attack. Healing process that after heart surgery. Irregular heart rhythms can occur in normal, healthy hearts. What are the types of arrhythmias? The types of arrhythmias include premature atrial contractions. These are early extra beat that originate in the atria, the upper chambers of the heart. They are harmless and do not require treatment. Premature ventricular contractions, PVCs. They are among the most common arrhythmias and occur in people with and without heart disease. This is skipped heartbeat we all occasionally experience. In some people, it can be related to stress, too much of caffeine, nicotine, or too much exercise. But sometimes PVCs can cause by heart diseases or electrolyte imbalance. People who have lot of PVCs and or symptoms associated in them should be evacuated by a heart doctor. However, in most people, PVCs are usually harmless and rarely need treatment. Atrial fibrillation. Atrial fibrillation is a very common irregular heart rhythm that causes the atria, the upper chambers of the heart, to contract abnormally. Atrial flutter. This is an arrhythmia caused by one or more rapid circuits in the atrium. Atrial flutter is usually more organized and regular than atrial fibrillation. Arrhythmias occur most often in people with heart disease, and in the first week of the heart surgery, it converts into atrial fibrillation. Paroxysmal supraventricular tachycardia, that's called as PSVT, a rapid heart rate usually with a regular rhythm originating from above the ventricles. PSVT begins and ends suddenly. There are two main artery types, accessory path tachycardias and AV nodal recurrent tachycardias. Accessory pathway tachycardias, a rapid heart rate due to an extra abnormal pathway or connection between the atria and the ventricle. The impulses travel to the extra pathways as well as also the usual route. This allows the impulses to travel around the heart very quickly, causing the heartbeat unusually fast. AV nodal recurrent tachycardia, a rapid heart rate due to more than one pathway through the AV node. It can cause heart palpitation, fainting, or heart failure. In many cases, it can be terminated by using simple maneuvers such as breathing and breathing down, and others performed by trained medical professionals. Some drugs can stop this heart rhythm too. Ventricular tachycardia VTAC, a rapid heart rhythm originating from lower chambers or ventricles of the heart. The rapid rate prevents the heart from filling adequately with blood. Therefore, the less blood is able to pump throughout the body. This can be a serious arrhythmias, especially in people with the heart disease, and may be associated with more symptoms. A doctor should evaluate this arrhythmia. Ventricular fibrillation, erratic, disorganized firing of impulses from the ventricles. The ventricles quiver and are unable to contract the blood pump contract or pump the blood to the body. This is a medical emergency and must be treated with the cardiopulmonary resuscitation (CPR) and defibrillation as soon as possible. Long QT syndrome. The QT interval in the ECG is the area on the echocardiogram that represents the time taken for the heart muscles to contract and then recover for the electrical impulse to fire the impulses and then recharge. When QT interval is longer than normal, it increases the risk of torsade de pointes, a life-threatening form of ventricular tachycardia. Long QT syndrome is an inherited condition that is caused by sudden death in young people. It can be treated with anti-arrhythmic drugs, pacemaker, electrical cardioversion, defibrillation, implanted cardioverter defibrillator, or ablation therapy. Bradyarrhythmias. These are slow heart rhythms which may arise from a disease in the heart's electrical conduction system. Examples include sinus node dysfunction and heart block. Sinus node dysfunction, a slow heart rhythm due to abnormal SA node. Significant sinus node dysfunction is a causes symptoms treated with a pacemaker. heart block, a delay or complete block of electrical impulse as it travels from sinus node to the ventricles. The level of the heart block or delay may occur in AV node or his Purkinje system. The heart beat irregularly and often more slowly. If it's a serious heart block, then it's needed to be treated as a pacemaker. Thank you.